Hi everyone, I'm Aanchal Chauhan and I'm currently pursuing my master's in lifespan counseling from St. Xavier's College, Mumbai, India. I'm also working as an extern with Rochester Institute of Technology as a part of their RIT Priority Behavioral Health externship. I would like to present my research poster on the effectiveness of in-person and telemental health services for the homeless in India. So I would just like to provide a little bit of background into the mental health struggles of homeless population in India. So homelessness has been a growing concern for India, and the statistical data of 2010 says that there are 1.7 million people that are homeless in India, out of which half of the homeless population is struggling with mental health issues. And due to the lack of shelter, they are forced to live in very despicable conditions. They are forced to live in roadsides, pavements, under the bridges, which makes them much more prone as well as vulnerable to the incidents of victimization, stigmatization, as well as discrimination, which further worsens their mental health conditions. And even though mental illness have been found as a significant contributor to the mortality rate of the homeless due to existing barriers like overburdened healthcare system, shortage of resources, stigma, lack of access, the mental health needs of the underserved population is easily out to be sidelined. So telehealth can make the mental health services much more accessible to this underserved population because they would be able to avail as well as access the services from the comfort of their homeless shelter. So telehealth has also been utilized and resorted to in the times of the pandemic to unburden the healthcare system of the increased search for the mental health services, and it has been used to continue the providing of the services while maintaining the social distance norms as well in the times of pandemic. Hence, with such multiple potentials that telehealth holds, it becomes very imperative to study its effectiveness and to assess whether telehealth can be used as an alternative medium to in-person therapy, and that is what the current study aimed at doing. So the aim of the current research is to assess the effectiveness of telehealth for the homeless population in India. The purpose is also to assess whether telehealth is as effective as in-person therapy and can be utilized as an alternative medium to provide quality mental health services. So we conducted the study in a homeless shelter in India, and the criteria to be the part of the study was that the participants had to be the residents of an Indian homeless shelter and they must be voluntarily willing to receive therapy. In this particular study, 42 residents of a homeless shelter in India, they were provided therapy, out of which 63% were females. And the participants were first screened for the appropriateness of telehealth services using screening tools like PHQ-9, JD7, and DSM crosscut. And the clinical diagnoses that were found among the residents were depression, psychosis, substance abuse, insomnia, PTSD, somatization, dementia, intellectual disability, out of which psychosis, depression, substance abuse were much more common. And following the intake as well as screening based on their risk level, cognitive abilities, as well as language ability and familiarity with technology, 21 participants were provided 30 minutes in-person session and 11 participants were provided telehealth therapy sessions using evidence-based therapy like CBT, TPT, and MET. For example, if we assess the participant at high risk and in need for in-person mental health services, they were provided with in-person therapy. While if the participant was assessed to be appropriate for telehealth services, provide his low risk, provide his familiarity with technology, he was provided with telehealth services. And these telehealth therapy sessions were provided using HIPAA-compliant video platforms like Doxy.me, and the participants' pre and post distress was then recorded by the clinicians for each session. The effectiveness therapy was then assessed by comparing the impact of telehealth session and in-person session on the distress scores of the participants, where the distress scores of the in-person session were used as a comparison standard. So this pre and post session distress score were recorded on a scale of 0 to 10, where 0 meant no distress at all, while 10 meant worst possible distress. And what was observed that there was a decline in the distress scores of the participants for both the modalities. For example, as you can see in the graph, which is titled as telehealth versus in-person distress score, the average distress score for in-person pre-session was 4.7, and for post-session was 3.3. Similarly, the average distress score for telehealth pre-session was 4.9 and for post-session was 3, which meant that the telehealth as well as the in-person sessions were impactful in reducing the distress scores of the participants post-session. So there was also a decline in scores that was observed across the sessions as well. For example, if you can see in the graph, which is titled as session-wise telehealth versus in-person distress scores, in session 1, so all the distress scores for both the modalities, the pre as well as post, are high. And as the session progressed, there was a decline in the scores, that is in the post-distress in-person scores as well as pre-distress telehealth scores, pre-distress telehealth as well as post-distress in-person scores as well, which showed the impact of telehealth in reducing the distress scores of the participants across the session as well. So this study holds importance as meeting the mental health needs of this underserved population has been a challenge in India due to the huge treatment gap that exists. And the study also allows to assess the effectiveness of telehealth in comparison to the traditional model of therapy and whether it can be used as an alternative medium to provide the quality care. And that is what we plan to assess in future as well, by providing services to more participants using telehealth and conducting statistical analysis to assess whether telehealth is comparable to in-person therapy. And that is what the study is all about, and the study will be all about. And in the end, I would just like to extend my humble gratitude to Dr. Carolyn Easton for providing me this opportunity, and Dr. Rupa Kalahasti and Dr. Corey Crane for their constant guidance and support. And in case of any queries, you can contact me at aanchalkanchan@gmail.com. Thank you so much. Have a great day.